Hello, my name is Sarah Geierstanger, and I work at the University of California, San Francisco. Today, my colleague Samira Solomon-Poor and I will be presenting to you on SBIRT and SBHCs evaluation and quality improvement. For the past several years, she and I have been working with the School-Based Health Alliance to evaluate their SBIRT initiatives and have come up with some ideas and recommendations about how to most effectively conduct an evaluation of this type of intervention. So first, I want to say that we have no commercial disclosures. We are both research and evaluation consultants with the School-Based Health Alliance. The reasons to evaluate SBIRT in school-based health centers are basically the same as why one would evaluate any public health program. You want to document the efforts and effectiveness of the services you're implementing. It's super valuable to be able to report, obviously, to the school-based health center staff, as well as funders, policymakers, and education and community stakeholders about how the SBIRT implementation is going and how effective it is in order to advocate for additional funding and support. And then at the program level, it's super valuable to have the data to conduct continuous quality improvement. And those of you in public health, I'm sure know about the CQI cycle, which is basically first looking at the data that you have, monitoring your implementation, making sure that the data are accurate, they reflect what you're doing. You identify as a team areas to improve, you implement those changes, and then the cycle begins again. And you look at your data again to look and see how it's going and make the changes you need. So in order to engage in this process, you really need to have good data. So we put this table together just to demonstrate some examples of variables one might collect, both process data and outcome data. Process data is the most easy to collect. The most obvious indicators would be demographics of the client served, how many and what type of screenings you're conducting, if you're providing referrals, and then of those referrals, how many result in services being provided. Outcome data is a little bit more challenging, but of course very important to have. Collecting the frequency of client substance use over time, as well as self-reported client confidence in their ability to limit their own substance use. And we also collected data on changes in provider knowledge and attitudes and confidence in implementing SBIRT. As this is a relatively new intervention in a lot of school-based health centers, we found this to be very important data to collect. We also listed evaluation questions because when you're writing, for example, an evaluation proposal, a grant proposal, funders are very interested to know what you'll be able to do with the data. And so by presenting evaluation questions, they can get a better idea of what you'll actually be able to do with the data that you collect. So again, back to the process data collection, these are the three main steps. First, obviously deciding what you want to collect. Again, screenings, results, and services and referrals provided. A big and challenging step is reviewing and modifying the electronic health record so that these fields are embedded in the EHR and can become an integral, sustainable part of the clinic process. So we found that working with IT staff at the clinic or agency level is really important because they're the ones who know how this best works with your clinic flow, how your EHR works, etc. And then it's challenging, but important to figure out how to extract the data from the EHR in a routine, regular way so that you can make sure that the data you're collecting are accurate and you can engage in that CQI process. Here are a little bit more detailed list of some of the clinical evaluation measures. We found two main ways of looking at the data. One is looking at client level data. So during a particular reporting period, of all the clients you saw, how many had at least one substance use screen? Of those, how many were positive? And of those with a positive screen, what kinds of interventions and referrals did they receive? You can also look at the data at the visit level. So of all visits during a reporting period, how many included a substance use screening? And of those, how many were positive screens? So we developed provider checklists. This is just a sample, and we have more detailed versions. Providers can use either a paper form to actually check these off when they're meeting with the clients to make sure that they're doing all of these different activities, screening, providing interventions and referrals, or they can enter directly into the EHR if that's available. Okay, so now Samira is going to talk a bit about the outcome data collection portion of evaluating SBIRT in school-based health centers.
Thanks, Sarah. So the other half of evaluation is to collect data that show the effects or impacts of your intervention, also known as outcome data. The clinical data that Sarah reviewed can also be used as outcome data if we look at changes over time to answer questions like, did the percentage of clients screened for substance use increase as SBIRT was implemented, for example. Additional methods that we can use to collect data to measure the outcomes of SBIRT are survey or interview data, either at pre and post implementation or just post implementation if time and resources are limited. For example, we can do surveys with providers that assess changes over time as a result of SBIRT implementation and their knowledge of SBIRT, and changes in confidence to implement SBIRT, as Sarah had mentioned earlier. We can also do surveys or interviews with school administrators or school staff to measure changes in their perceptions of things like having resources for students with substance use concerns or seeing SBIRT as an effective alternative to discipline. Next slide, please. Along those lines, we can also do surveys with clients of the health centers themselves. And Sarah mentioned some of the measures that we could look at for outcome measures we could look at using client surveys, which would include frequency of substance use over time, increase in knowledge and awareness of things like risk of substance use over time, and also asking about their resiliency factors and as well as their satisfaction with SBIRT providers and the SBIRT intervention overall after receiving it. There are some challenges to consider when conducting survey or even interview evaluation data collection, and these aren't necessarily barriers, but just items for consideration before you launch into data collection. One is that you would need consent for participation in evaluation, and this is often done separately from consent for services. And depending on the content of the survey or the questions that you're asking, you would absolutely want assent from the youth who are taking surveys, and you may also need to obtain parent consent for them to participate in those surveys. And you would want to just check your agency policies as well as the school district and school level policies on conducting surveys in schools. Another item to consider is reaching youth to complete the post surveys. So pre-surveys are pretty easy to collect because they can be administered during one of the first couple visits to the health center. Post surveys are a little bit more challenging just given the nature of school health center services with students coming in and out at different frequencies. So you just want to think about in advance at what point you want the post surveys administered, be it after X number of sessions or X number of months. And you may need to call students into the clinic to take a post survey if they don't already have a follow-up appointment scheduled at that time interval. A couple of other things to consider are self-report and recall bias. So self-report, you want to just make sure that students feel comfortable disclosing information on the survey, and anonymous surveys often provide a little bit more of that comfort for when you're asking students about things like substance use or other potentially sensitive topics. And recall bias can be addressed by asking students if, for example, if you're asking about frequency of substance use, it's probably easier for them to recall their behaviors in the last month versus their behaviors in the last 6 months. And then lastly, sometimes we want to look at evaluation data to see if there's differences in outcomes for students who receive different levels of service. And it's not always easy to actually look at their service data and link that to survey data. So the easiest way to address this challenge would be just to add a question to the survey asking the students how much intervention they received. And while this is subject to self-report bias, it is one way to get this information pretty easily from students. Next slide, please. So just really quickly, a more intensive evaluation of SBIRT could involve looking at youth's academic and health records. So this means actually getting their academic data from the school and looking at indicators such as attendance or disciplinary actions over time, and then also accessing their health service data from the electronic health record to look at services received and health-related outcomes. And then you could potentially link those data with data from the pre-post surveys that we just talked about. This is a more intensive type of evaluation and comes with additional challenges. One is that the consent processes are going to be a lot more involved to be able to access these records, and you have to be mindful of both FERPA, which is the Federal Education Rights to Privacy Act, that requires parental permission before you can access students' educational records, and also HIPAA, which protects health records. You might need a health release to be able to access electronic health record data for your clients. And to do this type of study with rigor, you're going to want to secure a comparison group of youth who look like students who are receiving the intervention and collect the same type of data from those youth, so that you can assess whether there are differences in outcomes depending on whether someone received the intervention or did not. And finding a comparable group of students is can often be challenging, so just need to spend some time thinking through what this means for your evaluation. And then lastly, as we talked about, linking data from different data sources and linking service data and health data and academic data, you want to be able to collect enough information to be able to link those records, but also protect confidentiality at the same time. So we want to come up with a system that does that pretty securely for students. Next slide, please. So obviously collecting data for evaluation is crucial, but also disseminating is another crucial step in evaluation, and how we disseminate and package data may look differently depending on the audience. And so this chart just shows if we were going to share our evaluation data for the continuous quality improvement process that Sarah described earlier, we're probably going to look at more detail. The slide shows that if we're looking at data to see how we're doing in terms of meeting our goal of screening 75% of unduplicated primary care clients during the school year at least once for substance use, we can monitor our progress monthly. And we see in the month of November, there's a little bit of a jump in the percentage of clients screened when providers have been trained in SBIRT and are fully implementing SBIRT. And then we can just watch the progress over time and make changes as needed in the process, depending on what the data are telling us. Next slide, please. And then when packaging data to share with your external stakeholders, so funders or school partners, that's going to look probably a little bit different than what we share internally with our staff. And so this just shows an example of a chart that you would share with external stakeholders, showing where we started at pre-implementation and where we ended post-implementation, to show the impact or the effects of our project over time. And when sharing data with external stakeholders, you just want to make sure that it's both visually appealing and that the interpretations of the data are easy to understand and digest. So that's it for our very quick overview of conducting evaluations of SBIRT in school-based health centers. This slide has both Sarah's and my email on it, and please feel free to contact us with any questions, or if you'd like to see any of the tools that we referenced in the presentation, we'd be happy to share some examples of evaluation tools with you if you're interested. Thanks for your time today, and hope you have a good day.
Thank you very much.